Hello. So welcome, Rae, and welcome to
Thank
the
you.
Ketamine podcast. First time in a while we've been doing an interview, so we're switching things up.
Yeah.
And so do you mind telling the audience who you are and a little bit about your background? You're a naturopath.
I am a naturopathic doctor here in British Columbia, so across the Big Turtle Island from you.
Yeah.
I've been practicing since 2012 here in Vancouver, and I've had both my own private practices and within other clinics, and also started my own clinics. I've also been in the nonprofit world and the business development world, and now most recently I started a consulting firm. So I have some sort of varied business experience, and have always taken a view of social enterprise in my businesses. So in the clinics I've run, we really have a community focus, and the business is more than just sort of the sort of health practices that occupy them, but we have a lot of community programs and other things. So yeah, it's been an exciting almost 10 years. 10 years.
Right.
Yeah, it'll be 10 years this year. Yeah.
Wow, that's awesome.
In practice. Yeah, thank you.
So you put up your naturopathic clinic, and then you offer some alternative services in your clinic, which are interesting.
Yeah. So it's actually the clinic that I work in now, which is the same clinic brand. So I'll just explain this. So it's Empower Health Clinic. So if anybody wants to check it out, it's empowerhealth.ca. I actually don't own anymore. It's gone through different changes of ownership. So it feels like my clinic, and a lot of the same people are still there. My former business partner actually is one of the key principal shareholders of the clinic. We actually, in the process of a lot of learning in the last 2 years on interesting business development and practices and ethical business development, we explored steward ownership models. And so I know this isn't necessarily the topic of this podcast, but in the exploration of how to make the world a better place for many, many means, and doing that through business, was changing ownership models of business to really reflect community values and to keep capital inside of communities. So we actually have an interesting structure in the new Empower Health business, where we actually have ownership is actually separated from profit shares. And the idea from that is to prevent the sale of a business to bigger corporations, where you may lose the sort of local flavor of the business, or you might get sort of corporate cutting of corners of services, things like that. So it's a whole topic unto itself. But when we look at what it takes to make a healthy planet and healthy people, the social environments and the economic environments that we live in are really important. And this was our sort of way of trying to figure this out. So I'm actually not in any ownership position on the clinic right now, but I am. It is where I have my practice, and I was instrumental in originally getting all the programs set up in the clinic, and I do work as part of the integrative team at the clinic still. So, still a key person involved there. So, but yeah, so I can speak to all of this, and not just that. I also support from the experience of having now run programs and set up the business in multiple forms now. Through my consulting firm, we actually now help other businesses and organizations do similar things. So I actually do help design, programming, integrative and transformative health programming.
That's cool.
Yeah.
So it's not just like the one-to-one model, like you're expanding out to just the business model, and then community programs that you're offering to help people choose different services and ways to get involved, it sounds like. Yeah.
It's like I say, it's kind of re-looking at all these sort of things that we think of as one thing. And so when we first created Empower Health, back in 2014. The business planning for that happened in 2013. We really were looking at what does it mean to be actually truly integrative. And what we noticed were that clinics that call themselves integrative are just a bunch of different practitioners under different professional regulations working in the same building who may have an occasional conversation with each other. It wasn't about the integrative health of the individual. And I think naturopathic doctors are unique, and because we learn so many modalities, we're really good at bringing things together. And I think that we're really good at doing clinics and integrative clinics. And what are the challenges that we face bringing different professions together and different modalities together? And so much of that ends up becoming a socioeconomic like initiative, right? And so what's been very unique about the Empower Health model is that most patients feel like they're being taken care of by a team, not just by individual people. And there are always going to be patients that just want to see their one doctor or their one therapist. But it's, being that sort of environment of being a home away from home and to feel that you're looked after by a team of people, and people can come and go and are certainly not replaceable. Like we definitely have an emphasis on, we have an emphasis on the practitioners themselves, right? It's not just about a faceless brand. Like that's not what it's about. Like the brand, like the Empower Health brand is about, celebrating the individual practitioners as well and their unique gifts. And there usually isn't ever a replacing of a practitioner, right? But something new comes in to replace that from the bigger perspective of looking after a patient, but it's very rare that we can replace a practitioner. And I mean, that is something that we're getting better at and encouraging the development of, replicable programs, which I'm sure we'll get into a little bit in this, but, there can still be a program framework that practitioners can come and go from, but they're always going to add their individual element. And that relationship is with the person, right? And I think that's what, the corporate models don't do very well, is the brand is more important than the individual practitioners. And there's a drive for efficiency. So you want to, standardize everything. And you can do that to a degree, but there's a limit. There's a limit before you actually start compromising client care. And, that's the dilemma that every sort of clinic business owner faces is, how do we make it a profitable, sustainable business, right? And this is another reason, not sure how far we want to get into this, but why the public health system, is, not working for so many people, right? Is that the cost effectiveness, right, of healthcare delivery and the profit margins are small. And, it costs the government a lot of money. Like, our socialized healthcare system costs the government a lot of money, which I'm not saying is not bad, but when you get into private healthcare, you realize, that, to provide quality care, what it actually costs.
Right. And
why doctors, MDs spend, 5 minutes with people on one thing and then you're gone. Right. And it's just like, we complain about that, but it's like our country would be more bankrupt. It's already very bankrupt. It would be even more bankrupt if they were to provide quality care. Right. Yeah. So it's like, it's real catch-22.
It's really hard. There's like a balance, right, of like providing quality individualized care and then standardizing it to, like you said, efficiency, cost effectiveness, but then even to allow to give patients so they can expect what will happen, because there's so much individuality and variability, but then you want to, kind of have some sort of system or some sort of framework that people can expect. Like, I'm going to see my ND 3 times and then I'll maybe see the nutritionist for my plant, but everyone's so individualized that it's tough to figure out how to, what that journey will look like until you actually sit down with each person. Like, we work from such a grassroots level in our training, right? Like, we're working with the individual person and their needs, and then to scale that up is always the trick. So anyone who has alternate models, it's always interesting to look at, to see like, what are you doing differently than just the the typical one-to-one, someone comes in, sees you, maybe you refer, you know, and then you figure it out as you go, or you maybe based on your experience, but you're figuring it out one session at a time. Like, it's nice to see we're working as a team and figuring out how to manage expectations, how to create some sort of model, how to get somebody from point A to point B with their healing journey, and you know.
Absolutely.
Yeah. Because that's how we communicate as well. Like, that's how people refer. They say, I went to this person, I got these results. Yeah.
And you know, it's interesting, you know, bring it back to the naturopathic perspective, you know, and how we're taught and how we're trained, and just actually the journey that I see a lot of new naturopathic doctors go through, and is like, you know, you cast such a wide net, right, at first, you know, into that person's life, and you know, the art becomes, you know, refining that into and focusing that into things that you can you know, replicate from patient to patient, just to, you know, just to like actually, you know, not spend 5 hours.
Right.
you know, when I first started practicing, it was like, okay, so and I was spending, you know, 4 extra hours for every hour I spend with a patient. It just does not work financially for me at all. Right. But that's the thing, is like, we're really taught to see everything, like the full, and I think that is actually how medicine should be taught. And it's just unfortunate that there isn't that time for us to synthesize, you know, and be able to have that learning, you know, without it being such an impact financially. Like, that's to me, the dilemma of private healthcare is like, it's pretty much on the job training. You don't get those 4 years of internship that regular MDs get, and where you get mentorship unless you get yourself into a good clinic. So, you know, those initial years are a lot of work, you know, learning how to treat clients. So
not just like the individual care, but also the models that you're working with, like you mentioned, and how to integrate teams, and what your clinic model looks like. And and that business side of things is something, like you said, we don't really get much of in school. So that's a learning curve in and of itself, and a side project to engage in. Like, how do I actually do the business thing?
Yeah, exactly.
What's your clinic? So your clinic is unique in that there's ketamine-assisted psychotherapy element to it.
Yes.
So tell us about that. Like, was that always part of your clinic? Is this new? Maybe we'll begin even with if there's a story where it all starts.
There is a story. And so if I may, so before, while I was still going into naturopathic college, I met I will always call her my business partner, even when she's not. She is still my business partner. She's a lifelong friend now, and her name is Helen Loshny, and we had some very transformational personal development experiences together, and were introduced independently to psychedelic medicine, and actually met in the psychedelic community here in Vancouver. And it was when it was still, I mean, there's been obviously, we all know that psychedelics have been sort of had an initial renaissance in the 60s. And, you know, then there was a sort of a big clampdown, you know, in the 80s and 90s. And then in the last 10 years, we've seen a renaissance of psychedelic medicine. And we've seen a lot of efforts, you know, starting with cannabis, which some people don't classify in psychedelics, but certainly in the plant medicine world, in the mind-altering substance world, one of the first substances to sort of hit the decriminalization movement. And then subsequently, we've seen in the last 2-3 years that same movement happening with psychedelic medicines. So, you know, back 10-15 years ago, I think it's almost, it's like maybe 12 years ago when I met Helen, we were sort of in the midst of this inquiry into, hey, like, these things are, why are they illegal to begin with? And are they really that unsafe? You know, no, they're not that unsafe. I'm not saying there's not risks. We can get into that, but certainly, you know, when you get into the nitty gritty of what happened with psychedelics, just like most controlled substances, and this is a philosophical debate and a moral debate. Most of them were made illegal because of racist, classist laws, and those laws and so the Controlled Drugs and Substances Act, I recommend everybody read this thing, just demystify it. It is, when I had been in this world for, I don't know, a decade before I went and read that. And I knew there was lots of people fighting for decriminalization. Like there's people fighting for decriminalization of all substances, right? And, you know, treating this as, treating these things, substance addictions and all this as substance use problems or medical problems and social problems rather than as, you know, a criminal offense.
Right.
Right. And so when you go to read this part of the criminal code, you just realize how colonial and racist and classist our governments were at the time of making these laws. And this is what is in the process of being reformed. So back several years ago now, or a few years ago, cannabis was actually removed from the criminal code. And more recently, in January of this year, the Special Access Program, which was created originally for access to drugs that were not approved by Health Canada for rare conditions like AIDS, so for life-threatening conditions. So there's a movement to get access to drugs. Well, when that was created, scheduled drugs were excluded from that, which included psychedelics. So even if somebody had a life-threatening condition, they were not able to access these substances outside of research. So a lot has happened. And so just prior to this sort of resurgence, like back in 2012 to 2013, Helen and I got together and, you know, from having had, you know, personal experiences, and witnessing people having profound personal experiences in our lives, in our personal lives, and you know, people who had gone to Peru to take ayahuasca, and you know, learning about people's mushroom trips and all these other things. You know, as people who are very interested in mental health and healing. So Helen's a registered counselor as well. There was just no denying, and not just mental health, but physical health, like the healing that can happen from taking these substances. So, and we knew that these things were not available legally, but in the process of exploring what these substances made available to people, so especially in the context of community settings and Indigenous settings, you know, for many of us who are, you know, descendants of immigrants, don't have, you know, it's in our DNA, but we don't have access to it from a cultural perspective. These ways of healing and knowing that people often get exposed to when they take these substances, we wanted to create, like we specifically created Empower Health to emulate that caring community and social environment and transformative environment with transformative therapies like breath work, you know, transformative counseling, you name it, neurofeedback. Like we incorporated like trauma counseling. We incorporated modalities into the clinic and a community setting in the clinic for people to integrate, you know, transformative experiences into their lives. Even our massage therapists and our physios and our, you know, and naturopathic doctors, like anybody working in the clinic, were chosen because of their values, you know, in terms of relationship and, you know, who they were as people, and they're also their ability to hold space for people no matter what, in terms of like what they're going through. Inevitably, this attracted a lot of people who are part of the psychedelic community. So we kind of became a hub. So, you know, different groups, you hosted, you know, integration circles at our clinic, and because we had a studio space and stuff, you know, and we just got a lot of people who came to us because they'd had psychedelic experiences and knew that we would be sympathetic to what they were going through. You know, unfortunately, as a naturopathic doctor, I don't think there is a jurisdiction in Canada where we are allowed to prescribe controlled substances. So even cannabis, we're not allowed to prescribe here in British Columbia, even though it is removed from the criminal code. There's definitely limitations in terms of our prescription. So as a naturopathic doctor, unfortunately, I don't give, like, I can't give people general advice, or sorry, I can't give people specific advice on their health around how to take psychedelics. But I certainly, if somebody is already interested in doing them or is already doing them, like I can take care of their mental health and physiological health around doing them. I have, some, specific knowledge about how these things affect our brains. And they're, contrary to what many psychedelic enthusiasts might think, these things have impacts and they can have physiological impacts and they can have psychological impacts. And so from a harm reduction perspective, we can help people, through these experiences or after these experiences. But yeah, back to your original question in terms of where did the ketamine-assisted therapy come from? And I think we probably want to talk a little bit specifically about ketamine, because a lot of people are like, ketamine, where does that come from? Based on like 5 years of operating in this way with this team-based environment, we then discovered that ketamine was actually a legal psychedelic. And it's kind of interesting because when people are interested in psychedelics, now it's totally different. Like 2 years later, or 3 years later now, it's completely different. Back then, like people who were involved in psychedelics, most people only think of the classic serotonergic compounds. Like they think of DMT, they think of magic mushrooms, they think of ayahuasca, MDMA. These are all serotonin-based compounds. And some people call those the classic psychedelics. Ketamine, it's been known for years to have psychedelic properties, and there are many practitioners using it across the globe. And it's known mostly here as a street drug or a party drug. In the infamous K-hole, everybody kind of knows about this. But when done in a controlled setting, in a controlled therapeutic setting, it has very typical characteristics of a psychedelic experience. And it's a prescription medication that can be used legally. So there was a time 3 years ago, and so there were already some people practicing this, in BC, sort of under the radar, doctors. But yeah, so 3 years ago, we opened our first ketamine-assisted therapy program. Very soon after that, due to what we think were press releases by certain psychedelic companies in Canada, it brought this practice onto the radar, and colleges across Canada, and I'm specifically thinking BC right now, I'm not sure how it totally went down in Ontario, but very similar regulations. They put out a notice to all their registrants, to MDs, that they can only practice, ketamine can only be used in a hospital setting. So it took it out of the regular physician's office for a while. That has since changed as of last summer again. So there was a period there where nobody was practicing it out of their office, and physicians were told to stop practicing it. But in that window of where we from us discovering that this was an incredible therapeutic tool, there was about 6 months there where we were able to train people in how to use it, as well as bring some patients through. And that sort of formed the basis or the original foundation of the first ketamine therapy or ketamine-assisted psychotherapy program. It's known as CAP if you're using the term psychotherapy, or CAT with just ketamine-assisted therapy. We tend now to use CAT because if you get into the counseling and psychology realm, psychotherapy is a specific type of mental health therapy, and we don't necessarily just ascribe to psychotherapy. There's all kinds like somatic therapy and other things that are very profound healing tools, but that are not in the specific category of psychotherapy. So we wanted to broaden that because ketamine is useful as an adjunct to multiple types of therapy. So that's why we call it that. So that's kind of the history. So in the meantime, as I was telling you before, we had a little thing called COVID happen, and there was a business changeover. So we've gone through actually 2 or 3 different ownership structures since that time in the clinic. So there was a lot of business experimentation going on over the last 3 years. After reacquiring the business about 1.5 years ago, That's when I subsequently turned it over to a newly created management services company that's practitioner controlled, which is what I spoke about earlier in terms of this steward model organization that we're now experimenting with. Because, again, getting back to, these are these beautiful therapies that we have going on. How do we preserve them to stay in service to the community? So that's how the ketamine-assisted therapy started. It is now being running again. So the current iteration of the program is now running again at Empower Health since September. And I'm not sure how many patients they've brought through now, but it's I would say it's still in the beta phase. But it's going really, really, really well. It's amazing. And the results are incredible. So yeah, happy to get into as much of that as you'd like today, or move on to other things. Yeah.
We haven't discussed this, and it is a legal therapy in Canada.
It is a legal therapy. Yes.
You're going through a little bit of like a roller coaster politically and like the legality, but you're able to prescribe and deliver it for mental health, like for depression or.
So in British Columbia, it's not. So it's a bit complicated. So ketamine is a very complicated topic. So there is a actual brand name, ketamine product, which is the S-enantiomer of ketamine, which is, got your there's racemic, and it's made up of R and S molecular forms, isomers. Yeah. They've isolated, so Janssen, owned by Johnson & Johnson, so Janssen Pharmaceuticals, who we know because of vaccine manufacturing now. Right. Janssen created a isolated S isomer of ketamine that they say is like kind of more psychedelic or more therapeutic. They claim it's actually not, but they claim that it has a slightly different effect, like perceptual effect on your perception. They created what's called it's S-ketamine, and the brand name is Spravato. Spravato is approved by Health Canada for treatment-resistant depression. Mm-hmm. Because it's approved by Health Canada for treatment-resistant depression, it also opens ketamine up. Ketamine itself is a generic. It's in its racemic form is a generic medication. It's used in hospitals for procedural sedation. It's used by paramedics. It's used by in pain management. It's actually listed by the WHO as one of the 10 essential or most essential medications. It's carried in the battlefield. It's very few side effects, like negative physiological side effects. Very safe. It does not cause respiratory depression. So especially in the emergency room, even if somebody's very sedated, they'll still breathe. And so there's lots and lots and lots of benefits. It also does not cause any loss of blood pressure either under sedation. So its physiological properties are very safe. And there are cautions. There are things that you need to be careful of. And because of those perceived dangers of ketamine, it was reserved for hospital settings. But out of hospital settings, it was being used off-label, not extensively for mental health conditions, but this opened it up. So this approval of this drug opened it up for mental health conditions across Canada. And each provincial college of physicians have to decide what the regulations are around how somebody uses this, because it is a sedative. So the danger of ketamine is not that it's like physiologically dangerous, but this is not something you prescribe. You can prescribe it to take home, but under specific settings. People do that for pain management, but it's because it's so mind altering. You're impairing somebody, right? So for the most part, these drugs are used under supervision, medical supervision. Mm-hmm. So I was actually involved with helping with research into policy recommendations for the College of Physicians here in British Columbia in terms of how it's regulated. So it was actually a momentous occasion for all of us in the psychedelic world when last summer the College of Physicians came out with interim guidance, which you can read on their website. It's a couple pages, allowing ketamine to be used non-IV, so either intramuscular, sublingual, or intranasal ketamine inside of a community setting for mental health, but they will be reviewing how to do this, like the regulations around this by the end of 2022, so this year. Similar processes and initiatives are going on across Canada right now, and I actually can't remember exactly where that process is in Ontario right now. It may be that it's only sublingual available there. If it is intramuscular, it's possible that they've opened up intramuscular injections there too, but people are doing it, but each province is deciding how physicians are allowed to administer this. So British Columbia opened it, so that was great last summer, which allowed Empower Health to restart the ketamine program, and which I had just described. So yeah, it's pretty amazing because at lower doses, it's a therapeutic adjunct. So in the way that it's approved, S-ketamine is approved. So and S-ketamine, by the way, is which is Spravato, the Janssen product. It's a nasal spray, and it's done in the presence of a psychiatrist or a doctor who's approved to do it, and they give it, and then they use it as an adjunct to therapy. But it's lower dose, and it kind of gives a euphoric feeling. This is probably at the dose that people like to use it at parties. You're still functional, you can talk, you can have a conversation, right? It's not totally psychedelic at that point. And it's kind of more, I would say, in the category of MDMA for people who have gone to parties and tried MDMA. It's it sort of lowers inhibition and creates a sense of relaxation, and it's like openness in the body. MDMA lasts hours and hours and hours. You have this horrible come down, as a lot of people will report. Whereas ketamine lasts an hour to an hour and a half maximum, and there's very little post effects to it. Like you're back and you're not feeling terrible from it. So as an adjunct to therapy, or as MDMA therapy, which we can also get into because that's a whole thing that's coming down the pipes here in Canada. MDMA therapy and psilocybin and these other psychedelics, like they're really long acting, and it's a huge thing. It's a huge commitment for both the therapist and the client to get into that, right? And you have to have all kinds of things ready for that person, and possibly staying overnight and those kinds of things. Whereas ketamine, you're in and out in 3 hours. It's very conducive to a clinical setting. So it's a very nice, friendly from a clinical perspective. It's one of the friendlier psychedelics, and it actually is a friendlier psychedelic and a lot more predictable than some of the others. But at higher doses, so in lower doses or intranasal or sublingual, it's more of a euphoric effect, and you can certainly, doing intranasal or sublingual, you can certainly get some pretty powerful, effects from it. It can definitely knock you off your feet, which is why anybody using this stuff with patients need to understand what's going on with it and what the potential of it is. But intramuscularly, which is what we primarily do at Empower Health, it has a very instant dissociative effect, and for people who understand psychedelic lingo, you journey, you actually go on a journey, and you might see things, and you might have realizations, and you go into a transcendental state of some kind, or a dissolution state, ego dissolution. And so it's different for everybody, because that's the uniqueness of psychedelics. But that's why a lot of people don't know or didn't realize that ketamine has this, that can be classified as a psychedelic, because depending how you dose it, it may or may not be psychedelic. So if you're a clinic or a practitioner focusing on psychedelic-assisted therapy, right, and wanting to emulate a mini version of a psilocybin trip, or some of these other substances, the intramuscular injection or layered sublingual or layered intranasal, going to higher doses or higher concentrations in the bloodstream before you get to anesthetic dosing. So before you get to you're completely gone
Right.
for things like surgery and stuff, you're still aware, like you have an awareness, but you're just not completely in the room. And that's where people can, in the coming out of that, right? So it's one thing to have the experience, but in the coming out of that, when there's a therapist present to help you integrate that experience, and then in subsequent therapeutic sessions, right? Like that's when, the work happens and the sort of mental reintegration happens. Yeah.
So that's interesting. Yeah, it's like a low dose. It's just a little bit of like reduces inhibitions, allows like maybe therapy to be assisted to go a little bit more smoothly.
Yeah.
Maybe gets past some psychological barriers, something like that.
Yeah.
You can have anesthetic doses where you're completely dissociated and unaware that you're getting surgery performed on you. And then you're working in this middle ground where it's a psychedelic. You're really working with the dose with intramuscular and then sublingual.
Yeah.
And you're getting to this place where someone's having an experience.
Yeah.
What's that journey? So when a patient comes in, what's that look like? Like when they come into the clinic, maybe it's their first time. Do they lie down and then get it? And then what happens? Do you mind walking us through that?
Yeah. So there's the intake process. People, I know that Empower has not advertised it at all. I think they may be starting to soon. I know the person comes in and either speaks with a staff person or a nurse just to do some basic screening. Like, is this even appropriate for you? Like, let's not waste your time or money if there's some major medical contraindication, or if it looks like you could probably use some other types of therapy before you do something like this, because it is a big commitment, both financially and I know Empower keeps their prices as low as possible, but there's a lot of people involved in the provision of this therapy. There will be an initial screening interview, and then the client will get funneled into a medical screening and a therapeutic screening. Intake or assessment, like a more in-depth. So with the therapist that will be following them, as well as the medical doctor who's there to assess them medically and prescribe them the ketamine. Either of those two processes could result in you're not going any farther than this, because it's basically like they're separate. There are physiological reasons why this may not be appropriate, and there are mental health reasons why it might not be appropriate. And those two things are assessed separately. If somebody is more complicated from a psychological standpoint, if they've had, it's not so much about the history so much as, what their current mental state is, right? So anybody that has sort of complicated mental health picture, like a personality disorder, or significant trauma that's affecting them, in ways that the therapist that's doing their assessment doesn't feel confident in their ability to really know if they're ready. Anything where there may be any more sort of complicated diagnosis questions around the mental health, they will be sent to an actual psychiatrist or a psychologist if that's not who's already assessing them. They'll be sent for an actual psych assessment, just to get the go ahead that this is a safe therapy for them. It's always better if they have a relationship with a psychiatrist or a psychologist or a counselor, so that there is that longitudinal history of somebody that's looked after their mental health, who can really say, yeah, this is a good therapy for them. That doesn't always happen. And not everybody has access to really good mental health services. And, but we always, the medical team at Empower, tries to communicate and create a relationship with their existing care team. So medical doctor or counselors or psychologists, because that's so important. I mean, that's how Empower Health works, is there's a team there, right? So the team doesn't always have to be inside the clinic. The team can be anywhere, right? It can be their existing team. It's their team. They get to choose who's on their team, right? It doesn't have to be a branded team. It's like, no, it's like your team could be comprised of many doctors and therapists and whoever across the city, right? So having communication with people is important, and getting that consent from patients to have that communication. So medical records are often requested. We look at their medication record, right? We look at their labs. Like there's a lot that gets looked at. Then if the therapist says, yeah, this is good to go, if the doctor says it's good to go, then they're booked for their first ketamine session. The therapist often, which I've seen happen, will book them for additional therapy sessions. If anybody's done anything in the realm of psychedelics, I mean, everybody's heard of like the psychedelic horror stories, like the person doing it totally unprepared in their teens. And, you know, this is a more controlled setting and it is a more forgivable substance than a lot of people have tried in their teens, but it's still a profound experience and it's not to be taken lightly. So the more preparation that somebody has going into this experience also means they're going to get more out of their healing afterwards. So understanding why you're doing it and ensuring that you have the support. So that's another thing in the intake is who is there in your life? What are you going back to after your session, right? Like this is going to rewire your brain for a temporary period, but you can certainly go rewire it back to the way it was if you go back into the environment that you just came from. So so there's a lot of care taken in the whole process that somebody's going through. And then, you know, comes their first ketamine session. And, you know, every clinic and practitioner of psychedelic medicine, whether it's underground or above ground or whatever, has our unique flavor to this. And, you know, we think of it as this sort of one thing. And the way that a lot of corporations and sort of companies are portraying psychedelic medicine right now is this sort of like, here's the recliner, here's your noise canceling headphones, here's your eye shades, like, you know, my original background in psychedelics was in a community setting, group ceremonies, like these kinds of like indigenous kind of settings, right? Very different than your clinical setting, right? With like earphones and eye masks and all that kind of stuff. Nothing wrong with it inherently, but you know, and there's people that are definitely more geared toward these kind, like either way. There's a whole you know, whole spectrum in between of what the actual experience, like the kind of setting that gets set up for that client. So in Empower Health, it's a cozy, you know, therapeutic office environment with a, you know, either like a thick sort of mat or mattress or you know, a convertible chair into bed kind of thing. So somebody can either be sitting or lying down. With ketamine, it's typical to, unless it's a low dose therapy session where you're sitting up and talking. Typically, if it's a psychedelic session, you're lying down because you're just not capable of standing up. Right. And yeah, eye masks are encouraged usually with ketamine because it does cause some visual disturbances if you don't have an eye mask on. That's not necessarily the case for other types of psychedelics to have an eye mask on the whole time, but a lot of them are done in the dark traditionally and other things, right? Anyway, so yeah, it's the person comes in, they'll be just assessed by the nurse or medical professional on staff to make sure that there's nothing out of you know, out of the ordinary happening that day, because they've already been assessed medically, but you know, they're not supposed to be on substances or have eaten too much, or you know, there's some medical considerations, blood pressure is taken, all that kind of stuff. And you know, dosing is prepared and the therapist is with them, and the nurse stays with the patient until they've reached their peak blood concentration and a little bit after that. So there's usually somebody in the room medically trained until they know that, you know, they're safe and on the other side. And then the therapist is in, if not the whole session, at minimum, the whole time somebody's conscious, you know, and helping them through the experience. So it's possible to, in some models, and we do have this as well, we have nurses that are therapeutically trained. So there's a lot of nurses that kind of cross over into also having counseling and therapy training. So it's possible to have just one person sitting with the patient if they have both qualifications. And it's again, it all depends on the therapeutic needs of the client and what it is that they need. So having one or two people can depend, but they definitely have to have that legally. There has to be that medical monitoring because there's a certain time that blood pressure is taken in the middle of the session and stuff like that. So yeah, and then you know, with ketamine, it's you know, one-off sessions can be profound. They don't often change people's lives. It's usually a minimum of 3 to 6 sessions, at least that's the going sort of thought paradigm in the ketamine world, the ketamine-assisted therapy world. But certainly people do feel some profound changes often after one session. There's usually, an integration call or sort of checkup calls in between sessions. Sessions can be done once or twice a week. They can be spaced out 2 weeks apart. Again, individual to the client and the plan that works for them, works for their life, works for their schedule, works for their physiology, because if it's intense for them, they may not want to be back in 3 days doing it again, right? But it's very rare to do one and then have that be it. Like, it's usually done in a series. Mm-hmm.
And so when someone comes in, like so there's 2 aspects, right? The psychological aspect, the physical aspect. And are they talking while they're having their journey? Are they usually silent? What does that usually look like for the person who's experiencing it? When they're
as a person who's having the journey talking, or the therapist?
Yeah, like are they getting therapy? Are they mostly silent and having
during the action? So in the psychedelic model, it's mostly silent, and there'll be some processing coming out. So there'll be some talking to get the person, like to get them into it, and then there'll be a lot of silence for about an hour as they're not paying any attention usually to what's going on outside them. If they're lucid enough, they may want somebody's hand, right? And if the therapist is trained in somatic touch therapy or trauma-informed touch, they can place their hands on the person in certain areas, like the shoulders or the hands, sometimes on the chest, feet, those kinds of things, head if appropriate, sometimes a little neck distraction or something. These things always discussed ahead of time, because once you're under the influence, like you may not be able to say no. And there's always debriefing afterwards, like, did that work? Because sometimes the person's like, yeah, go ahead and touch me, but in the actual session they can't say no, and it wasn't a good experience for them. And then they debrief that afterwards, what worked, what didn't. So there is a bit of experimenting in the first session. Obviously the most common touch is the hand holding. Like when somebody first gets that initial injection, we're talking like 0 to 60, right? Like it's, there's a flood that happens in the system, and it can cause anxiety for some people. Not everybody. For some people, it feels like a dissolving into like the ocean, right? And it's fairly relaxing. But for some people, it's like launch pad. Like it feels like you've just been strapped to a rocket launcher ship, and you're going out into outer space. Or actually, outer space is, well, sometimes outer space. The themes that come up with ketamine are a bit different than the other psychedelics. Like it tends to be more of a dissolution process. But I've done a few legal therapy sessions myself with ketamine, and one of them was down in San Francisco at Polaris Institute. And they do great work down there. They do ketamine training as well. And I felt like I was in one of my sessions pulled back through a wormhole.
So there's like this almost physical sensation.
Yeah, huge physical sense. Like it's very somatic. Yeah, for me it was very somatic. So I don't think that anybody should be giving this to anybody if they haven't experienced it. So there are legal ways of experiencing it. And so I think anybody giving this therapy or providing this therapy or doing programming, in my case for this therapy, should be doing it without experiencing it. And this is across the board with psychedelics. And somebody said once, it's like, would you ever get sex therapy from somebody who had never had sex?
Right. Or would you ever get a haircut, I guess, from someone who's never had one? I don't know.
Yeah. It's very much like, like how could you possibly know what somebody's going through? So anybody who's gone through psychedelic experiences know how not ordinary they are. This is why they're called non-ordinary states of consciousness. And you cannot apply the same psychological the same sort of psychological theories and programming and counseling that you might have learned even you might even be the best counselor in the world, and you certainly those counseling skills come in handy, but they get reoriented toward what's going on. And a lot of what's taught, so I'm not sure if you've heard of the Multidisciplinary Association for Psychedelic Studies in the US.
Right.
MAPS.
Mm-hmm.
Yeah. So MAPS, one of the first nonprofits in the psychedelic realm, they recently made headlines because they brought forward MDMA through phase 3 clinical trials, successful phase 3 clinical trials in the US, and which is now in the process of being approved by the FDA. So that's a whole other thing coming down the pipeline here as well in Canada. So they do a training program for MDMA therapy, and it's really based on unlearning a lot of the things that people learn in counseling and psychotherapy. It's really about, and actually as a naturopathic doctor, completely got it very quickly. But, you know, our sort of removing obstacles to healing, like, you know, when we learn about healing isn't about what we add to people, it's what we subtract. And so their whole therapy training program is based on that subtractive model, and it's about intervening as little as possible, but in precise ways to help the flow of what we would call the vis, like the natural innate ability of the body to heal itself. In this case, the mind to heal itself. We all have that natural ability to heal, and really, it's about getting out of the way. So the therapist's job is to provide a safe environment for somebody to do that, to provide the container for somebody to do that, and provide some direction. Like, it's kind of like providing the road signs, right? But not telling somebody where to turn, right? It's like, okay, there's some bumps on the road here, or hey, you might want to pull over here, right? But you're not saying turn left, turn right. Like that's that person's journey, and really respecting that person's journey. So that's what their therapy program is based on with MDMA. And I think that can be applied to all psychedelic therapy. A really skilled psychedelic therapist, and I'm not one, by the way. I mean, I just have a lot of knowledge in this area, and I would certainly love to. I did take the MAPS training, so I've done a lot of training in it, but I do the training myself so that I can better understand how to fit all these therapists and medical doctors and program, like people into a program. Like, how do people fit? What's the best care for people to experience? So I don't necessarily have while I have enough training to sit with people, I don't do that for the purpose of doing it. I do it because I really want to make sure that how everything fits together makes sense and that's so when people are really, really, really good at the therapy side of things, and I've worked with absolutely phenomenal therapists. Like, I feel through my whole career in Empower Health since 2014, I have been exposed to just some of the best, in my opinion, therapists in the world. Yes, there's a lot of good therapists. It's pretty rare to find a bad therapist. They're probably out of business. So there's a lot of really good therapists that people like, and people love their counselors, and that empathic ability to sit and be with somebody and hold up their space. And then there's a level in this sort of like 1% or whatever of people who have just another level of skill, where for certain people, like, you know, that's necessary, or where they've got to. And so to be able to insert an art form. So for the most part, training people on that very, I don't want to call it passive. It's not passive, but it's definitely like it's less directional therapy. So it's better to default to that with psychedelics. Like, be less directional. Let people learn, for goodness sake, that they're capable of healing themselves. Let them learn that first, because the medicines will teach them that. Like, it sounds so esoteric, but from a brain physiological perspective, there's a thing called the default mode network that psychedelics inhibit, which actually allows for those, you know, primitive, original healthy neurological patterns to emerge that may have been pruned throughout our lives, right? So it's like, that's why it can be so scary, because you literally peel back layers of the onion in somebody's brain, right? And so psychedelics this is why they're so notorious for like being scary, because, man, you just want to start to uncover all the repressed everything that you've had for your whole life, because we are now taking away your brain's ability to like repress that. It's scary, right? So yeah, so it's better that people therapists learn how to create very safe environments for people and not to be too directional, because you can really screw somebody up if you say like the wrong things, like if you push them into the wrong direction. But I've been fortunate to work with people who do know how to apply directive therapy well. It's never 100% going to work well every time. The psychedelics are very unpredictable that way. But when you do see somebody in action who knows what they're doing, it's pretty phenomenal. And you can get some just incredible work done on these things, like incredible work. Most of the work, like I said, is done by the person and by the substance. And then there's this added sort of, icing on the cake or cherry on the cake of a really, really, really good therapist. So
it's like creating that set and setting, but then also it sounds like very intuitive in a sense. It's like very minimal touch or minimal intervention, but where it's applied is maybe just kind of help that person like kind of nudge on the path that they were supposed to go down. It sounds a little bit like that. Like it's not so much, not a lot of talking, maybe. Just small little interventions to kind of help.
Yeah. That's what a lot of psychedelic therapy is. Now, when you get into traditional uses, or psychedelic churches and things like that, like this is a whole other category of psychedelic use. So I'm really talking about the therapeutic model where you have somebody who is sort of an outsider to you. They're not part of your community. There's a therapeutic relationship. It's a very Western model. Versus doing these things in community settings, which can be equally, if not more, healing, right? Because you're having these experiences with other people, right?
But there's that group container and the ritual associated with it,
right? So very, very powerful. So that is a conversation unto itself, and a deserving conversation. Unfortunately, that stuff lies in the realm of traditional use. It's not going to happen in a clinic. But as a clinic, we support people on the other side of those experiences, right? So having psychedelically informed therapists means if you're having been through that experience, and you're having a hard time afterwards, you can certainly come see somebody at our clinic. You could come see me. I you know what I mean? Like, I have people that, they haven't come to me for psychedelics, but they, in the process of their intake, they'll say, when you're asking about drug use history, like you'll learn that nowadays everybody's microdosing and everybody's has gone to Peru to do ayahuasca. And, obviously that's an exaggeration, but it's so common now. So I can now make connections that, that maybe other doctors haven't made with their use and what's going on in their life or their healing or whatever. So,
yeah, like a lot of patients have mentioned things like, in the setting in which I experienced like magic mushrooms or something like that, like psilocybin was at a party. And so I actually don't know how it might apply to my mental health or my psychological state, my emotional health. And so it's, creating that different context for them in a therapeutic way is a whole other ball game, right? And especially with ketamine, like people have heard about, the first time I heard about ketamine was in the context of partying in K-holes. And maybe you could just say what a K-hole is so we can
so to be honest, like I think that some people use the terms slightly differently. I think they kind of use it to because the successful use of ketamine in a party setting is not becoming incapacitated. So a K-hole is when the ketamine incapacitates you. But I think for some people that might be a psychedelic state. Some people it might just be they got knocked off their feet, and some people it's like they may be well into anesthetic, totally dissociated ranges, right? So I haven't, it's kind of funny, like I'd like to actually talk to people who don't have the therapeutic lingo and like just do it at parties and be like, what is your definition of the K-hole? Maybe I just need to look on Google. I've never done that before. It's like Google will tell us everything. Actually, there's a website called Erowid, EROWID. That is like the encyclopedia of psychoactive everything, and it's like a Wikipedia. So people upload experiences, trip reports, like science, everything. So I bet you we could get a really extensive library of K-hole references in there.
And what they are.
So basically the K-hole, essentially in a therapeutic setting, you are inducing a K-hole every time.
Right.
Like it's like Yeah,
Therapeutic
it's a not really like what they call it, like it's the opposite of a euphemism. It's like it's not a very nice way of like, it doesn't make it
It's like
sound
a
very
literal
appealing.
way. Yeah.
Yeah, it doesn't really make it sound like it's something that's desirable when you're going
Right.
into a K-hole. But you know, some people, that's what they're trying to do, maybe like in their personal recreational use. But most people using it personally and recreationally just want to loosen up dancing or whatever, right? Feel good. It's definitely used commonly with cocaine, because cocaine is ketamine kind of makes you just want to lie down and cuddle, and cocaine keeps you up and talking, and you know, and both of them are short acting. So both of them have about an hour or two max, like where they're acting. So they're kind of this like, you know, perfect. Say, I have to be careful. I'm not recommending this to anybody here, but just like that's what people say. Like it's like
recreational standpoint.
It's from exactly. It's from a recreational standpoint. They, you know, you don't want to be committed for 8 hours. Like MDMA is from a recreational standpoint. People will do that at festivals and dance all day and night and stuff. But you're committed, you know, 6 to 10 hours of being high. Same with LSD. Same with mushrooms, right? So ketamine and cocaine are at least I know in Vancouver, really common and very commonly used together in the party scene. Yeah. Yeah.
And that also kind of pollutes someone's experience, because they may not have a pure experience with ketamine, and they're certainly not doing it to like access their childhood or process something or have a journey. Like
no. And I think there's I mean, there's certainly a big stigma around ketamine because of its party use. Like I was involved in psychedelics and wanting to revive them and decriminalize them and all these other things for, you know, at least more than a decade before I knew ketamine like that. Like even within the psychedelic community, it wasn't recognized because of that stigma. Right. It was being done legally for years now. It's being done legally down in like in California and other states.
Right.
So it's actually being used legally for a long time as a psychedelic and as a therapeutic tool. And so just for me, it was like, how is it that, you know, and there was a psychiatrist using it here in Vancouver that I knew of and for a while. And I was told about this and was told that clients could access this, and did not put 2 and 2 together. Yeah. I just was like, great, that's great.
Well, it's sort of like, you know, if your goal is to be at a party and dance, and then something makes it difficult for you to stand up, it's going to be a horrible experience because it's completely mismatched with what the effects of the drug are and what you want. But if you take that same dose and that same effect and you lie down in a very comfortable, therapeutic, compassionate space, it completely changes the experience. So this is like the set and setting thing, right? It's a huge aspect of psychedelic use that oftentimes the set and the setting is wrong, and that's someone's initial experience with it. And this is probably why so many of these substances, these chemicals have been tainted for so long, because people are like, oh, this is what it does. It's horrible. You take it and you lie down and people tell you what you did and you don't remember.
Yeah.
You're like, no, this is what's it like when someone's going through the therapeutic process, they're with the counselor, and then they're starting to come off of it. You said they spend time with the counselor or the therapist afterwards and debrief a bit.
Some people need to be quiet. Like some people are so like they've just gone, you know, one experience I had, so I told you about the wormhole experience. I had another one that I felt like I had just been ground through the tectonic plates of the universe, right? Like I felt like part of my cells were going this way and part of my cells were going that way, and it didn't feel wrong in the sense of like, you know, like it wasn't like scary in the traditional sense, but like there was no body. Like I had no body and no sense of ego self. I was just somehow, you know, experiencing like opposing forces in the universe. And, you know, it was just I came out of there like really like, you know, even though you've been gone for an hour, like the whole universe has changed.
Right.
Right. And, you know, what the heck do you make of that? And I actually was quite nauseated. So ketamine doesn't generally cause as much nausea and vomiting as some of the other substances do, like ayahuasca, the traditional Peruvian mixture. One of the like very I'd say classical, well-known psychedelics on the planet, psychedelic traditions, very known for just being a purgative, right? So it causes a lot of nausea, vomiting, diarrhea, all kinds of stuff. Ketamine will cause this in specific people or under specific circumstances. So often if you've eaten, like your stomach wasn't empty enough, or if you just got a little bit too much, or you just happen to have a sensitivity to it. And this particular experience, I don't know if it was the dose or what it was, but I went so incredibly deep, and I just came out and was just like, I was supposed to drive somewhere. I had to get somebody to drive me. And mind you, in the therapeutic setting, you're always getting somebody to drive you afterwards. Like, but even if I wanted to, I wouldn't have been able to drive. So, people were up chit-chatting, right? So it was a small group therapy session. And I was just like, I didn't want the lights shining on me, right? So, so for the most part, people are pretty up and ready to go within an hour after the session. But, I remember that was like a good, couple hours, maybe 3 hours, where I was pretty incapacitated. So you have to be kind of prepared to be impaired for a little while. Again, it's not necessarily usual, but and especially if somebody is going through a lot physically or emotionally or whatever they're getting therapy for, that first session or second session or whatever could be really could really take them out for many, even if it's not a real physiological response. It's just, it's kind of like if you have a big emotional release or you have a cry fest, right? Like you're in a state where that needs to process for a while, right?
Right. Yeah. Like it could be just even like the physical effects of it, and is the therapist. So I want to talk about integration, but would integration happen right afterwards? Like, do people want to ascribe meaning to their experiences typically, or?
Yeah, so there's integration in the psychedelic world means a lot of different things. I mean, the ultimate sort of goal of integration is your life changes in some way based on the experience you had for the better. Like what that means more specifically. So if, and integration is the process that happens inside of somebody. Often people refer to integration as if it's like the type of session somebody gets or the type of therapy somebody gets, like integration therapy, right? Like somebody's going to talk you through, okay, here's the lesson you learned, and then somehow do counseling on you, and then you're going to integrate. So it depends what we're thinking about in terms of integration. So if we're assisting somebody in interpreting their experiences after their experience, that can assist in their integration process. Sometimes them completely letting it just integrate into their own minds it's more like reintegration, to be honest, like, because some stuff comes apart in the mind, right? In the body, when you do psychedelics, some stuff comes apart. And so integration is actually reintegration. It used to be integrated. It might've been like held together like this. Now we've pulled it apart and put it together like this. So absolutely, like that's what I was saying about good therapy. So the sort of classical, like what most people can do safely with people is just let that person integrate, create a safe space, remind them they're capable of it. That kind of therapy, versus therapists that really understand the process and have an extra set of skills to help somebody interpret. They can do some really good work. So there's work that can be done right after the session. Although for the most part, a lot of people, it's just let them be with it, right? And at least do minimal to make sure that they don't have something get in the way of the integration. So have something jarring happen to them, or go home to a yelling family or whatever, like that would really ruin the integration. Where a lot of this sort of integration process happens from a therapeutic perspective in subsequent sessions, so in subsequent therapy sessions, right? Because the person has had now time to go home, their brain gets put back together, all those things, and then they come back for, they either do a series and have little mini integrations, or they come back and then proceed with regular therapy after ongoing, right? And then my definition of integration is, okay, what social structures do they have in place? Like, what's their care team doing for them? How is their physical health? As a naturopathic doctor, it's not just about mental health integration, it's about everything integration. So people coming out of these experiences often want to get healthy. They're looking, they are able to change habits. Like, there's all kinds of stuff that can happen if they have the right, so the integration process goes well beyond psychotherapy, well beyond just what did you say after a therapy session, right? But those are all important, right? Like, I don't want to discount that, because in those moments after a session, or even leading up to a session, or in that week after a session, that rawness, like that vulnerability that somebody has, if somebody poisons that pool, like, it's like you've taken the lid off something, and then somebody throws some garbage into it, right? Like, it's like, well, what happens? That person puts that lid on harder the next time. Right. And actually, and I've experienced this personally, not just in psychedelic therapy, but in other sort of transformative practices like personal growth retreats and paradigms. You go through anything that kind of breaks down your view of reality, and there's a period of time where that needs to be treated and seen as normal in your life. So people in your life have to respect what you've gone through, and not everybody has that luxury. And that is actually one of the dangers of psychedelic medicine, in my opinion, and what we're going to see a lot more of, is when this becomes more common. It's like we kind of see it as a sort of panacea to fix all mental health problems, and I really don't think it is. It does have the potential to cause a rebound effect or a doubling down. And so you can have a significant re-traumatization happen in these experiences. So it's not that the psychedelic has an inherent negative effect, but the person's vulnerability and ability to maintain a new way of being or looking at the world or whatever, especially if that world isn't safe. Like, we live in a toxic society. So we do work and have worked closely with Dr. Gabor Mate in the past. He's done talks at our clinic. His new book, I think it's out now, but it's all about toxic culture.
Oh, wow.
He talks about the fact that, and many people have said this, like, mental illness is an adaptive response to a toxic culture. And we keep trying to, like, put a Band-Aid on a gaping wound, like, right. And this gaping wound is society, and we keep trying to make it about somebody's head. It's all in your head, right? We're going to fix you. We're going to do therapy on you. We're going to just give you a little bit more psychedelics, and then everything's going to be fine. And that is a misleading and dangerous to think that by just adding another therapy. What's that book? Oh gosh, Huxley, or it's all this
Brave
Huxley.
New World, is it?
I think it's Brave New World, like Soma. Like, they've got one of his books. He talks about essentially the mind-altering substance that it basically makes everybody happy. It's a bit. It metaphorically kind of crosses over into, like, the antidepressant, like the way we use antidepressants and stuff like that, right? And then there's another substance that actually more does, like, the opposite, which is awaken people. And this is, like, so long ago that I read this, but the way that psychedelics are being touted now, especially with microdosing and others, like, companies want to make a lot of money off this stuff, right? I think that their benefits are being exaggerated, and they're both being exaggerated and not at the same time, right? It's still a little bit of emphasizing the superficial aspects of what this medicine can do, rather than the deeper aspects of what this medicine can do. And in some cases, what we're probably going to see is a dumbing down of the negative effects of psychedelics. Like, there's already companies that are looking at creating the psychedelic without the psychedelic experience, and how much more comfortable can we make psychedelics? Like, classically, have these unpredictable effects, and in reality, that's what exercises your brain to actually be able to handle life, because life is not predictable, right? Life is not ever going to be what you think it's going to be on a day-to-day basis. So why should psychedelics be? So to put you in a state, there's no question, ketamine is, for a lot of people, it's like a warm hug, and a lot of people haven't had that. Like a lot of people have not felt comfortable in their bodies. A lot of people have not felt that blueprint of what it feels like to feel wholeness in your body and your mind. And it really does help to create that, right? Insofar as we don't, this will help you insofar as you don't start to use this as a crutch, right? And that's where why something like an antidepressant or an Ativan, that's the difference between harming and benefiting. Like taking an Ativan because you're scared on a plane once, no problem. I'm not sure, but maybe as a naturopathic doctor, you've seen benzodiazepine addiction. It's horrible. It's probably one of the most horrible substances I've seen people get addicted to. I don't know, I haven't done an in-depth comparison of heroin to benzos and getting off them, but I've seen just the horror stories of people getting off benzodiazepines and just the twisting of their brains that happens, after being on them for a long time, and the receptor damage that happens, the GABA receptor damage, right?
Yeah, I think it's probably the hardest thing to get off of. People can have lifelong effects afterwards. And this is something just recently the medical community has discovered, right?
Totally. It's crazy. And, we have so many examples of this in our society. OxyContin, Ativan, you name it, people are, addicted one way or another to mind altering substances, never mind all the legal recreational substances like tobacco and alcohol and etc. Right?
Yeah.
Caffeine, yeah. Right? Caffeine is a whole can of worms there, right? So then you've got these sort of stigmatized ones like heroin and cocaine and ketamine and all these other ones, right? So anything that's mind altering can become addictive if it makes you feel better in any way.
Right.
So ketamine, one of the cautions with ketamine, and I think it's unfounded and proven not to be a risk in terms of the studies that are out there. People fear that the increased use of ketamine for therapy may encourage more recreational use or may encourage it. I think if it's being applied like a drug, yeah, I think that's a risk. I think in the way, there's no evidence that when it's applied in this kind of a therapeutic setting that it encourages that kind of addictive use, because you don't want it or need it. The point is that you get through some of these issues to the other side. It's not just a temporary state. Now, lots more research is needed. Lots more clinical evidence is needed. We need to gain, across Canada and the world, community of practice around this, and which there is a growing community of practice. I'm on a couple listservs of people who are using this with people and sharing the evidence. Observational research, which I know that a few different organizations and nonprofits are involved in, and also, just we need more. Just like all our alternative therapies, we need a really good cross-pollination of knowledge so that this type of therapy can be perfected. So that's, again, to reduce the potential negative effects that it can have.
And just to understand, my question too is, who is it for? Who would be a really good candidate? And I'm sure there's different people, but I know it's you, we talked about depression is one of the indications, but it's sort of being what I'm understanding from it is treatment resistant depression. So you've tried perhaps 3 different therapies, and now this person is going to be referred to do ketamine with a psychotherapist. But what have you seen in terms of who benefits the most?
So again, on-label use of our sort of FDA approved product. It's treatment-resistant depression, which for those listeners who don't know what that is, it means a depression that has failed sounds bad, but like who has not responded to a number of other therapies. And it's actually, there's no standard definition of what that is, but in some cases it's one, in some cases it's 3 different therapies. That could be antidepressants, it could be electroconvulsive therapy, it could be psychotherapy, it could be, most time in the context of medicine, it's drugs that don't work. The other thing that is taken into account is patient choice. And that's actually written right into the ethics and code of ethics of physicians and practice standards and guidelines of most physicians. So if a person wants to do it and they don't want to do these other therapies, then they can often be also classified and are qualified to do it, qualify under that auspice. Worldwide, ketamine is used and researched for a number of mental health conditions, which include alcohol addiction, heroin addiction, cocaine addiction. It's very well researched in suicidality. It's used in hospitals to reverse acute suicidality. It's used in post-traumatic stress disorder. It's used in anxiety disorder. It's used in all kinds of caution as it is taken in people who have personality disorders, and that is often because personality disorders show up. They have comorbidities, right? So this person will have PTSD or trauma or depression, but when there's an underlying personality disorder, it takes in my opinion, a really knowledgeable, experienced therapist, because of the just the way that the person may respond to not just the treatment, but the therapist, right? So it also puts the therapist at risk as well, which is ultimately putting the patient at risk. So because it's an inappropriate therapy where, in the case of something like a borderline personality disorder, where there may be a lot of transference or inappropriate relationship transference onto or projection onto their therapist. If that's not recognized very early on in the treatment process, not a good thing, right? And you get and then you so there's some interesting ones like OCD and even schizophrenia. Ketamine could be great for people like that, or not terrible. And again, it sometimes depends on the person who, like the relationship, and it also might depend on the person themselves and how that's expressing in them, right? And so severe trauma, like PTSD, interestingly, is one of the things that's most being researched for use with like MDMA and other psychedelics, and certainly used in ketamine as well. It's a kind of a fashionable thing now to treat PTSD, right? Like veterans and, I don't know, like child abuse survivors, all these things, right? I think, so they're the people that could benefit the most from this therapy. And from a practitioner risk perspective, they're also the people who could have the most go wrong with this therapy. And so it's a catch-22, because it's interesting because the sort of wave of psychedelic enthusiasm, they're in order to justify why would we take this stuff out of criminal categories. Well, it's like, well, you got to pick the most destitute of humans, like who have like really severe problems, who have failed every other therapy, and now you think these are going to be a great person for you as a therapist to like have success with. And so again, it just gets back to like politically, like politics can get in the way of what's really needed. Like in my opinion, I think psychedelics should be available to relatively healthy people with a few minor problems. Let's get the population using these things and get some data and see what works and what doesn't. But instead, they're becoming available to like people with the most problems and the most vulnerable, who are at the most risk of having something go wrong, and that's not good for the patient or the therapist.
Yeah, we don't have enough data on like just healthy use in terms of like, just seeing what are the general effects on a healthy person. It's like we're using it to bypass maybe coping mechanisms in somebody who's experienced significant trauma and get them there very quickly. And there's a whole bunch of variables in that.
Totally. Yeah. And that's what scares me most about the current psychedelic renaissance, is that I think to convince policymakers that these are necessary, they're using people who really need desperate help. And it's just like, that's just going to leave it open for more things to go wrong. Another area, a really promising area with psychedelics right now is end of life therapy. And there's been many people now approved through Health Canada for Section 56 exemptions of the Criminal Code, which is the Controlled Substances Act. So they're getting exempt from that. And there have been therapists that have been exempt from it as well in order to get training with psilocybin, so mushrooms. And, so part of the campaign that was originally mounted by TheraPsil, which is a nonprofit, was targeted originally end-of-life therapy. So people who really have no other option, they're dying, and they want to try this as a last resort to help them, process and cope with their death. And not any psychedelic can be used for that, but they focused on psilocybin. So theoretically, although I haven't personally seen it used, ketamine can also be used for that. And there's actually a clinical trial starting in the US looking at ketamine and end-of-life anxiety right now, actually, people that I know in the States who are running that study. So, yeah.
I think, wasn't it Roland Griffiths who was behind some of the earlier studies, and it was for, like end stage cancer, and a lot of people, it was surveyed based on psilocybin.
Yeah.
Psilocybin, they were saying it's like the best or the most important experience they've had in their life. And fear of death was decreased, and meaning in life was increased, and like very, very therapeutic.
Yeah. So that's been definitely a popular area of study in the last couple of years. And I'm sure it will just keep increasing. But yeah, that's, like I said, there's a trial being started in the coming year on ketamine and that specifically too. So
that's interesting. Yeah.
Yeah.
And then you mentioned, you're seeing in your clinic, so it's gone through iterations because of the politics and things like that. But since September now is the current program, or the beta program. What are some of the things that you're seeing in terms of results? And I know obviously it's not typical, but what would somebody expect to gain from it or to experience? Like, do they come in with a goal of something that they want to change?
The benefits of ketamine therapy?
What are they noticing? Yeah,
I mean, and actually it's kind of interesting because I'm a little tiny bit removed from this current cohort of patients, like this iteration. But what the therapists are saying is they don't like, they've been suggested to have a minimum of 3 treatments, and that's so they kind of go in with that. And there's many of them now who have gone beyond that, and it's more a product of they're really getting, like, it's working. Right. And so they're actually, and so in a lot of the trials originally with IV ketamine therapy, it was done in 6 sessions. So I think what they're finding is that that more than 3 sessions is needed. And it's interesting because it's the patients who are asking for it. So they're like, yeah, we're getting somewhere here, and we want to continue this process. We want to go until it's done, kind of thing, right? I mean, I know just from not just this program, but previous programs and other doctors and stuff that work with ketamine, as well as my own personal experiences having tried it. There's generally a window where the actual physical effects, like the biochemical effects of ketamine, actually do create a temporary but lasting antidepressant effect. So typically people will describe it like around a week later. Some people it wears off after a day, some people it's a couple of weeks, some people, woo, their life's changed forever, right? But there will often be, which is why treatments are often spaced like a week apart, because you're catching it before that, downturn again. So there's a bit of like this honeymoon period, which is the opposite, right? It's opposite of honeymoon on the other side.
The waning period. Maybe.
The waning.
It's not a sexy term, but yeah.
Yeah. So there's a bit of a period, afterglow. That's a good term. There we go. Yeah. Afterglow. There's an afterglow of about a week, where people. So it's like the therapeutic effect in your life. So you've got the session, but you've got a week of therapeutic effect where, this is where if you're getting the therapy and stuff, you're getting the benefits of changing your mind and settling, getting more into your body, your anxiety is reduced, all of that stuff. Trust, like that's a big one. So, so many of all of us, I mean, probably on some level have some degree of trust issues. Right. And especially if somebody suffered PTSD or anything like that, depression, etc. So often in that trusting relationship with your therapist and with the team and all those other things, you start to develop a sense of trust, either in people around you or
in life itself,
life. Yeah, exactly. Yeah. Right. Like, hey, and in yourself. Right. So there's a trust that gets reestablished. And, that's a very visceral feeling. And that from a nervous system perspective or a somatic perspective or a trauma informed perspective, your sympathetic nervous system, right, is lessened, right? Mm-hmm. And you're taken out of these freeze states that people get into. You start to thaw out a little bit, you start to feel more, you start to be engaged more, and that can be a process that has bumps in the road in it. Like it's not just a linear process of healing. And again, more stuff could come up in the process of therapy and stuff like that. But yeah, in general, there's a relax, like a down regulation of the nervous system, which is great, and if that's the only thing that happens to people, it's a success. Like, because again, getting back to like what stops us from healing, like why do we need ketamine? Anybody can heal. You remove that obstacle. So if ketamine is taking that obstacle away, which is your high sympathetic tone, then you're put into a healing state. So for me, the experience after ketamine sessions is, wow, like I couldn't possibly deep breathe enough to get this relaxed, right? And if that's all it's doing for me, that's amazing. Yeah, because I know my body heals.
That. Yeah. Mm-hmm. Mm-hmm. Like I think I've had these conversations with patients where, and perhaps medication can also deliver some of these effects, but this idea that I think with the exception of benzodiazepines, you get to keep the neural connection. So when you're maybe the drug has an effect, like this afterglow, but when you're also applying therapy and you're helping your brain rewire, it may not be as potent, the sensation, but you're creating these new neural connections and these new experiences and this new way of being that I think can be longer lasting than just the chemical effects of the substance, which is what we're
absolutely 100%. Yeah, 100%. Absolutely. Yeah. No, I mean, like I said, and everybody's going to have unique internal and external circumstances to how well that works for them, right? Or how long that lasts, right? Or how deep they go with that, right? But that is the aim of it, is to rewire.
That's so cool. Yeah.
And I was talking to somebody about metaphors, right? So rewiring is a metaphor. I've heard refiling, right?
Yeah.
Reintegrating, interweaving. Like there's actually a lot of metaphors, and it depends on the experience that the person goes from. But like I've had a few people recently mention, and I've heard it before, but mention again, it was like, somebody organized the filing cabinet. It's like, yes, like who doesn't want their filing cabinet?
That's actually great. I'm recondoed my brain.
It's like, exactly. Totally. Yeah.
It's like, one patient described it. And this is, as we're talking, it's bringing to mind too, that any transformative experience can deliver some of that vulnerability and then that reintegration, like traveling, we were talking about before recording, or like a meditation retreat or a breakup, like sometimes a negative event, like if a patient's after a breakup, describe their brain as like shattered glass that needs to be reassembled. They're like, I don't know what's what anymore. And there's this vulnerable state there, but this potential for creating something new and for approaching life differently, right? Which is ultimately, I think, what we want. Like when you're speaking about this toxic environment, and do we just want to sort of be these fish swimming in toxic water and just adjust to that? Or do we want to feel the capacity to change things and change ourselves in that environment and thrive properly? Like, and I think this is the appeal for me of psychedelics, is this ability that we can fully transform and have the courage or see the possibility, right? Like it's hard, like you were talking about the nervous system. It's hard to know when we're talking about, you know, regulating your nervous system and not having so much sympathetic nervous system tone. If you don't have a direct experience with that, it's very hard to understand even what that's talking about. Like deep breathing, great, but when you actually feel relaxed and you feel that warm hug again that you might never have felt, that sense of the universe has me in some capacity, that if I jump into a void, I'm not just gonna fall forever. There's something there. There's some sort of order or love or something in the universe, or maybe there's nothing, but that's okay. Like there's some sort of understanding, some sort of teaching of our nervous system, what's there that you can fall back on.
Oh, totally. The blueprint.
You get to, exactly, you get to integrate with that original blueprint and the great beyond they talk about. What's next in the future of psychedelics? I know you're involved in more than just ketamine, but maybe briefly talk about like what are you seeing coming down? Maybe what projects are you involved in?
Yeah, I mean, so just from a broader perspective, I mean, and back to Empower Health and other clinics that are involved in this kind of stuff. So the Special Access Program has opened up psilocybin and MDMA. So what we're going to probably see is more applications to the federal government for exemptions to the criminal code for the purpose of, you know, people who have exhausted all options and things like this. So it's not necessarily the panacea or the wide access that would be available if it were just legalized or decriminalized. But it's certainly a move. It's an indication from the government that things are being thought about at that level when it comes to. So we will see some treatments come through. And the team at Empower Health, the therapeutic team at Empower Health, is trained already in MAPS MDMA therapy training, and we're in connection with Therasil that does psilocybin training, and so there's a lot of people. There are a lot of people ready in Canada to deliver these services. So once there's a legal mechanism to do so, either through decriminalization or regulatory changes, or legal access, we will start to see more treatments. So there have been some legal psilocybin treatments done, as I said to you, for end-of-life therapy. So that is up and coming as soon as the right circumstances are available and the right patient and the right doctor, et cetera, through Empower Health. So certainly if people want to get in touch with the clinic, they can, in terms of if they feel like they have a condition that is suitable for that and they want some advice around whether or not they would qualify, they can certainly get a hold of our clinic and ask them there. And then, but from a wider perspective like that, so the clinical work, I've been sort of moving away from, I still do my naturopathic practice, but I've been moving away from sort of really on the ground and focused in one clinic and a clinical setting to how do we actually get this stuff available more widely. So from a ketamine perspective, I'm also, I've been involved with the Ketamine-Assisted Therapy Association of Canada. I support with the research committee and the policy committee there. And I also, like I said, I have this consulting firm that I started called the Psychedelic Development Corporation. We've got consultants that specialize in sort of many areas of psychedelic medicine from a healthcare delivery perspective, right from the business side of things all the way down to the program development side of things. And actually, one of our key projects right now, we're involved with First Nations group. It's a group that actually spans across different communities, and they are very experienced in economic development for First Nations people. And we're looking at how to get these therapies accessible to First Nation people through programs that are designed by First Nations people. So rather than having, just a company go in and try to exploit or, think they're doing good by offering services, really focusing on the sovereignty aspect of healthcare in general, and how can we support First Nations communities to develop their own programs and their own way of using these medicines. We've already seen it happen in many other areas of First Nations governance, where they've started to regain control over, whether it's their health and wellness or their education, their land titles and rights, all those kinds of things. So for me, it's just for me, it's really in alignment with how I want to see all communities run, right? And in a sustainable, way that kind of gives back to its own community. So they have these social structures already embedded in their culture that are really conducive to creating unique and innovative healing systems, potentially also with the use of psychedelic medicine. So that's been my passion project for the last little while. It has, the clinical experience that I've taken from, the last decade or more of being involved in developing access to these medicines. I'm now getting to apply to, in a format that is in alignment with my own values of decolonization, right? And and I mean that from the broadest perspective, like working with communities that really understand this and deserve this as our original peoples, but also what can those people in their communities with their knowledge impart on us in our society, just getting back to healthy society, right? All of us, for me, I'm a white European descendant, and on one side, first generation. My mom wasn't born in Canada. She grew up here, wasn't born in Canada. My dad does, his ancestors do go back a little bit farther, English and French, but still, my ancestors are not from here. And we've totally lost connection with our, for many of us, our Indigenous roots. We're Indigenous somewhere, and, to start to reclaim some of those values into our communities as well, and get the support from First Nations communities in doing so. So that's what I'm excited about, is that kind of healing, like the social healing that can happen through, and how these medicines can be used in community settings as a catalyst for that, right? As a catalyst for changing our minds around how to look at the world. So, so first is like, put your oxygen mask on first, like do the therapy, but when you're well enough, the idea is it's like, how do you give back, right? So
that's very cool. Yeah, that's very cool. It seems like a natural progression too, to move beyond the one-to-one model to community model, very similar to what your clinic's doing. Like, how do we fully integrate and not make somebody an island who maybe's worked on some of their stuff, but it's how do we heal the entire community, which will heal the person as well. It's like and their worldview, like the First Nation people that I'm working with right now are, it just is not separate. Like healing community, healing family, and healing yourself. These are not distinct concepts, period, in all their rituals. And
And where they suffer the most is where those mechanisms were destroyed. Residential schools, destroying of their culture and their arts and all those things like that. It's just, for a white immigrant descendant colonial person here in Canada, even though I had exposure to and friends and people that were close to my family who were First Nations, a lot of that knowledge, that traditional knowledge, was kept underground and secret for a long time, just like psychedelics are kept secret, right? I had like zero clue to the extent that I was missing that in my life, like missing that missing community and cultural practices that are community oriented in my life. And having, we've been working with these people now, the psychedelic part almost becomes irrelevant, to be honest. And I think that in Indigenous communities, they were used very selectively and infrequently, and you know what I mean? Like, so it's kind of like, rites of passage type stuff, and like, oh yeah, like there's definitely some healing when people have ailments to heal them and stuff like that. But it's not, I mean, the kind of way that we're talking about psychedelics now is needing like just the level of therapy that people need. I mean, it is absolutely a product of us having lost our roots. And it's one of those things, like, again, like if you haven't experienced it, right? If you don't know that feels like in your body, and the security and the safety, like that feeling of safety in community, in a healthy community. There's some very unhealthy communities out there. I've been involved in very unhealthy communities. So yeah, but like when you feel it, when it's intact from a cultural perspective, it's amazing. And people, people experience this, all over the world, right? There are still communities that are more intact and have more community orientation. We talked about Latin America earlier. Yes, they've had their societies ripped apart, and they have, in many places in Latin America, really revived and maintained culture and community, right? And that's something that has not revived for a long time here in North America. And I think it's because it was in Europe, the colonization process within Europe happened a long time before they even colonized, right? So we actually, like, we've been colonized, like our brains have been colonized, for European descendants have been colonized way longer than the First Nations here. And I actually talked with my First Nations brothers and sisters about this a little bit. And it was actually a friend and colleague, psychologist colleague of mine, who, I can't remember who he quoted, but he said that, like it's I don't want to say they're lucky. Like, the First Nations people on this continent are not lucky that they were colonized, but when you think about, it's been like 400 years here, and it's really sucked. They still know what they're missing. Like, you go back into these communities, and as decimated as they were, I am astounded by the richness and how intact many of their cultural practices still are. And I'm envious of it. So it's reversed for me. Like, it used to be like, oh, feel sorry for these people who are so hurt and hard done by. And now I'm like, wow, like I am so envious of what you have. And it goes back to, we don't even know what we lost. And it's been gone for so long, that it's like, we don't even know what we lost. So we're not upset about it. But like, the more I'm learning about this, the more upset and angry I get at just, and I kind of feel a little bit sorry for myself in a way. It's like, wow, this is so crazy. I'm getting a healing experience, working with people that my ancestors harmed. And I'm the one getting the benefit and the healing from this, because, they don't need me. They don't need a corporation or, they don't need another health program from our colonial health system to go in there. Right. They just need to be allowed to, it's back to the obstacles. And those obstacles are often socioeconomic factors and, policies that discriminate against people, and resources and economic development and all these things, right? So I think they have all that they need, and they can certainly use help. And there's some communities that are worse off than others, right? And so I think there is a responsibility to support and help as much as we can, where we can, but there's also a what can we also learn back, and that's that part of that reciprocity, concept of reciprocity, like giving back, like you also have to receive, right? And so there's gifts that we can receive from that side.
And part of like decolonization is to go back to our own roots at the root of the colonization, which, like you mentioned, is hundreds and hundreds of years ago.
Yeah.
And that's so interesting. Like, you think of trauma as, it's horrible, but there's a tangible thing that's missing and that we long for. Whereas we may just have this like disembodied longing because we can't even articulate. And I think that's really interesting what you said too, but psychedelics are needed, like large amounts and maybe more frequent dosing schedules, because our nervous systems have been so disembodied and so isolated from others. And if you are in a community where there's one healed person or one person who carries the tradition, has the roots, the whole community kind of regulates with that person. But we're so isolated in
and that's the role of elders and spiritual leaders and all those kinds of things, right? And there's a natural hierarchy inside of communities where people go through teachings and learnings, and there's a lot of values of respect and care that are embedded into the culture. And again, not to idealize anything, and any community and culture and society has its toxic elements and everything, but it's how you heal from it. So how does a community, what norms and customs do people go through to come out to the other side of that? And there's a lot of lateral violence and really horrible things that happen in Indigenous communities because of the colonization. There's not great things that Indigenous people do to each other, just like we do terrible things to each other and across nationalities and communities and stuff. So, but yeah, I'm just really grateful every day that I spend working with these people, because I feel like there's a real balance of giving and taking, and it makes all the rest of the work that I'm doing make sense and why we're doing it. Because for years it just felt like, okay, we're this little safe haven in this very chaotic society. Like, yes, we can see that it's growing, but at the level of craziness that's happening in the world, it's like a drop in the ocean. Whereas working at the level of healing entire communities, you start to see how this could become the norm on the planet at some point. There's going to be problems. Humans are an interesting species. I'm not sure where I stand on people say, oh, the natural state of humanity is good, or the natural state of humanity is being at war all the time. Pretty much there's evidence for both. So, where are we going? What is natural? I don't know.
I think even in our own psyches, you have both tendencies, right? Everyone has a shadow, everyone has their value. And maybe we're leaning more into the shadow realm in these days, but I think I love this. This is so cool. Anything else you want to leave off with, Rae? Like any last thoughts, and where can people find you?
I mean, I've probably said a lot now. I practice out of Empower Health Clinics. That's empowerhealth.ca. My consulting company is called the Psychedelic Development Corporation. So that's PsyDev. I believe it's .ca now. I'm not remembering. PsyDev.ca. So PSYDEV. So those are sort of like the two areas I hang out. I'm on social media platforms and all that stuff too. I just am very grateful to have had this conversation with a colleague.
Thank you so much.
There's a naturopathic flair to it.
Yeah,
And
totally. And I'm
yeah,
part of, I think, some of these listservs and things like that. So we'll probably be in touch more about this. But thank you so much for this interview. This is great.
yeah,
Really
no
great.
problem. And I wish the best for everybody who are looking into these things, and to be safe. You know, definitely be safe and informed if you're getting into anything psychedelic. And like, yeah, if anybody wants more resources or needs more resources, we can certainly direct people, right? So, and
We
if
can
they
reach
can
out
ask
to you.
you, and we can direct
Yeah.
people to resources, because it's a very popular subject right now. There's
Definitely.
no shortage of information out there, but you know, is it the
And I
right
think
information for you? I don't know.
and people need help. And I think that's what it comes down to, is that there's a demand. So
Yeah. And you know, if people do have a person in their life, or if they feel like they are struggling and want to do legal psychedelic assisted therapy, and they're in Vancouver, they can certainly reach out to Empower Health Clinic. And if they're looking for other places in Canada to have access, they can also reach out, and we can help support, point them in a direction, or help find a referral somewhere. Yeah.
amazing. Thank you
Yeah.
so much.
Yeah, no, thank you.